Good morning, good afternoon, good evening, everyone, wherever you are. Welcome to our NCLEX 101 with Dr. Akolo. Today, we are going to discuss safe environment for care. So, this is just to help you with your NCLEX NJN, your patients. Then let's look at legal and ethical issues. So as an RN, when a resident or a patient needs to go for an like surgery or something that needs a procedure that needs consent, the provider is supposed to explain the consent because he is the one who's going to do the procedure and he knows what is going to actually do to the patient, and he can explain and respond to the questions of the patient. Your work as an RN is to witness uh, the patient providing the consent, and also witnessing, like the provider explaining everything to the patient. So the patient RN, you should just make sure that the patient is in a capacity to consent, that they've understood what they're getting into, they're mentally stable, like they understand the procedure very well, they understand the risks, and they're able to give an informed consent without any coercion. Also, under legal issues, you should know that clients have rights to refuse treatment and leave against medical advice. Your role in AMA is just make sure that the patient has the capacity uh, to, like decide that he's going to leave against medical advice. He or she knows the risks of doing that and also give the alternatives to that. So if the patient is incapacitated to go against medical advice, follow the state laws for holding the patient. Every state has their laws about on that. HIPAA is very, very important, that the patient's information is protected. Yeah, protected from people who are not supposed to access it. Yeah, so the patient has a right to decide who accesses their information, and the nurse is supposed to abide by that. Also, uh, the state laws have, they have they know which information, they know how to go about the HIPAA and all that, but the nurse should understand the states and governing about HIPAA, and even the policies of the hospital about HIPAA. But also, HIPAA, just Google, read it, and you get all the information that is needed. And then all patients are actually have a right to access medical screening and be stabilized for treatment, even if they don't have money or anything. But if they present to the ER, they have a right to access medical screening and stabilized treatment. That's according to the EMTALA. Every patient or every individual has a right to autonomy, to make their own decision, beneficence, and non-malfeasance. It's very, very important that you understand all this. Thank you. Remember to visit House of Molly for more information for the courses that we are offering. We're on more interaction. Keep checking our YouTube channel for more of such slides. Thank you very much. Bye bye. Have a good